Hi, welcome to Mishti, the world's first global NRI platform. Us NRIs, we have exactly the same problems. Then why are we looking for individual solutions when there's a much better option out there? If you're an NRI, come join the Mishti tribe. Whether it's taking care of our parents who are getting older in India, or whether it's the pain and pleasures of investing in India, Mishti is seeking the best solutions out there for us as a tribe. Today's topic is all about pain. Does getting older have to be accompanied with pain? Do our parents have to suffer from aches as they age? Turns out that's not the case. Any sort of pain can actually be managed and managed very well. Meet today's expert, Dr. Sudhindra who's a specialist in pain medicine and also a faculty of pain medicine at the Royal College of Anesthetics. He's a specialist currently practicing in Bangalore and very well sought after. And he's here, which we're very grateful for, to help us answer a bunch of questions we got from the tribe. Here we go. Question one, doctor. Is there a
Yeah,
difference in level of pain as we age?
I mean, honestly, I must say that's true. As we age, there is definite increase in the number of causes that can result in pain. Most commonly, degenerative diseases and unfortunately cancer. All these are the incidence of these is more as you age, which definitely means the pain experience that you would undergo as a part of age is high. Having said that, we should never accept that pain is an inevitable part of aging. We must strive hard to get the pain down to a controllable level so that people can lead their lives with a good quality.
Doctor, next question I have for you. What kind
Mhm.
of typical pain challenges do you see in older patients? So, what are the typical issues you see older patients complaining about when it comes to pain?
I think this question can be answered in two parts. One is what are the common causes of pain, and the other would be what are the challenges in treating these pains. Coming to the first part, as in what are the common causes of pain? See, the most common cause of pain, as I previously said, was degenerative diseases like spinal pain, joints pain, musculoskeletal pain, and also partly by the chronic metabolic syndromes like diabetes, which can result in diabetic neuropathy, which is like the burning sensation that they have in their feet and hands, and unfortunately, cancer. Cancer can have multiple causes, as in it could be because of the cancer, because of the tests that the patient needs to undergo to diagnose cancer, and also as a result of the side effects of treatment. So, which basically means there are hundreds of causes for pain. And coming to the challenges that we sort of face in treating these patients are multifold. As you would all appreciate, pain is no longer just a biological phenomenon. It has a huge psychological and social component to it. And these components are sort of exaggerated in the elderly population. And commonly, the challenges that we face are a sort of this misconception that pain is a sort of accompaniment of age and nothing can be done about it. That is not the right way to look at things. And also, there is a lot of communication difficulties in the elderly because of their impairment of vision, impairment of hearing, decreased cognitive abilities. So all these are sort of challenges. And the other challenge would be is that obviously most of these people would have multiple medical pre-morbid conditions like diabetes, hypertension, asthma, thyroid issues, heart issues, and many a medication might not suit them well. So it is sort of a very tailored approach needs to be taken up to get the optimum pain relief to them. And also a multimodal approach in terms of medications, minimally invasive injections, and physiotherapy, exercises, complementary therapies. So these are the sort of challenges that we face. Having said that, we also need to understand that the consequences of inadequate treatment of pain can be many. Uh, Most common is they are functionally impaired, they cannot do things on their own, there's a risk of falls, there are mood changes, there is slow rehabilitation, there is sleep and appetite disturbances. And also, we need to take care of the caregiver. If an elderly person continues to have pain, the caregiver does develop fatigue. So summarily, it's a big challenge, but that's
Mhm.
a challenge that we can address.
Are the signs of pain that should alarm you and provoke you to go and see a doctor?
Honestly, I mean, this is a very good question. So if I would use the medical parlance, there is something called a red flag. So every pain need not be dangerous. Having said that, every pain cannot be taken for granted as well. So I would like to use a specific pain example to sort of explain this. The most common pain you see in the elderly is low back pain.
Mm-hmm.
So more than 90% of these low back pains are non-specific and actually don't require any treatment. They get better on their own. However, we should educate people about what are called the red flags. What are the things that you should know that should prompt you to see a doctor. And in the specific example of low back pain, it would be sort of pain going down your legs, numbness, fever, weight loss, night pain, and bowel and bladder disturbances. So these are the sort of things that should make a person go to a doctor immediately. So speaking generally, it does mean that anything that is prolonged, anything that is going on for some time, it's not getting better, and you develop other symptoms like fever or weight loss, or you're not happy, you're not convinced that this is something normal, you should go and see a doctor.
Why do most aging patients develop pain in their joints? That seems to be a common pain point for most aging population. And what is the best thing for them to do?
Uh, See, these changes in the joints are like the changes in our car tires. So we do have wear and tear changes in our car tires, isn't it? But unfortunately, we can't change our joints. So we have to deal with it and get on with it. All wear and tear changes need not cause pain, but some definitely do. And there are multiple causes for why some people have pains due to wear and tear changes and why some people don't. The most common sort of factors that would tell us if a person is going to have pain or not is some genetic factors, environmental factors, and lifestyle factors. And obviously, you do understand that we cannot change our genetic factors, isn't it? That's what we are born with. So we can do a lot of lifestyle changes and environmental changes to manage the pain. It
Mhm.
might not be possible to completely get the pain down to zero, but we can definitely get it down to a more manageable level in terms of being active, doing some aerobic exercise, and taking safe medications as prescribed by your doctors, exploring the options of minimally invasive pain management techniques. And finally, for some indicated places, surgery is a powerful and a very good option.
Speaking of medication, doctor, is
Mhm.
Tylenol and aspirin bad for old patients? And if so, what is the best general pain relief medication over the counter people can use?
You have used the brand name called Tylenol, which is called paracetamol in the UK and acetaminophen in the US. To be honest, it is a safe drug, and in almost all patients, the only set of patients where it is not safe is in patients who have liver disease. And as you would know that this is one of the most common painkillers that is available over the counter. And when used in correct doses, it is a pretty safe medication. So I would think Tylenol is safe. Having said that, should not be medicating yourself with Tylenol also for a long time without the advice of your doctor. And I also think you wanted some advice on what is the best over-the-counter pain.
Pain relief.
Yeah. See, in India, everything is available over the counter. So for an Indian scenario, I would say don't buy anything apart from paracetamol over the counter. But I think in the UK and other Western countries, one of the most common painkillers that is available on an over-the-counter basis is ibuprofen. That too is safe for a short period, not more than 3 to 5 days.
What would be the one medication available in India that's quite popular that you would advise against people using without doctor consultation?
Honestly, most people would not even know the name of the medication that they would be using. They would go to a pharmacy shop, ask for a painkiller, he would give it. And I would assume the most common medication they would be giving is from a class of drugs called non-steroidal anti-inflammatory drugs, examples of which are ibuprofen, diclofenac, aceclofenac, and the common, I don't want to use brand names. So these are the common chemicals that are used. Yes, these are safe for a couple of days, but having said that, in certain populations like who have kidney diseases, who are prone to gastrointestinal bleeds, to have other medical comorbidities like hypertension, IHD. These can be life-threatening and dangerous if taken without the doctor's advice.
Which doctor do I need to see if I have specific pain? Are there different doctors for, let's say, leg pain, neck pain, back pain? Are there different specialists that one needs to go and see?
I'll sort of answer the second part of your question first, that are there different specialists? Yes, medical field is full of specialists, isn't it? So we have orthopedics, neurosurgeons, rheumatologists, and every specialization does deal with pain, because pain is one of the most common symptoms that a patient goes to a doctor with. Having said that, however, I think you should consult your general practitioner or your family physician should be your first contact, and from then on he can sort of refer you to other specialities as deemed necessary. I think that would be the right way of doing things, I suppose.
What are the typical geriatric diseases that are accompanied with pain? Do some become worse with time?
We'll sort of classify the causes of pain. So pain can normally comes in two varieties, what is called as acute pain and chronic pain. Acute pain is something that comes on, stays for some time and goes away. So in the elderly, acute pain could be because of a fall, a broken bone, or a stubbed toe, or anything of that sort. Most of them go away with time. They heal, the pain goes away as the healing is done. However, as we have discussed previously, there are multiple degenerative diseases, that is, the pains caused due to wear and tear as we age, the most common of which are spinal pain or the sciatica, and joints pain, most commonly hip and knee, and other muscular pain. So these are sort of the degenerative conditions that account for a large proportion of pains. And also cancer is a big concern in the elderly, and cancer not only because of disease, but also because of its investigations needed to diagnose cancer, and the treatment itself has its own side effects which can cause pain. So there are multiple causes of pain. And the other part of your question was, do these become worse with time? Some may or some may not, but if not properly attended to, most do get worse with time.
If somebody is suffering from chronic migraines, does
Mhm.
that come under pain management that you deal with?
Why not? Migraine I mean, to give you an introduction of migraine is typically termed as what is called a primary headache disorder, which to a common man would mean that you have a pain in your head and neck area, but you cannot find anything wrong with your brain scans or your blood tests or anything. Basically, which means that there's nothing wrong, obviously, but you have a lot of headache. And there are multiple characteristics and types of migraines, which can be diagnosed by any doctor, actually. So there are multiple sort of management modalities for migraine, which include pharmacological, which means sort of medications for migraine, and also a lot of lifestyle changes and complementary and alternative sort of therapies for migraine. Going back to the pharmacological side of things, uh, it is best to consult a doctor to know what sort of medications, what is the frequency, and understand what is the rationale of giving medications for migraine. And as you all know, there are certain triggers for migraine which are very stereotypical. What stereotypical means would be that each person has his own sort of a trigger. Some might have a migraine with hunger, some might have a migraine with stress, some might have a migraine with anxiety. And there are also instances where people develop migraine after being relieved from a stressful period of work. So everything under the sun can trigger migraine. And it might be a good idea to know what these triggers are and try to avoid them. So it is again, as with any other pain conditions, a sort of multidisciplinary and multimodal approach to treat or manage migraine.
What is the one piece of advice you would give Mishti community in taking care of their aging parents when it comes to pain management?
First of all, I think the moot point would be that let's not accept that pain is an inevitable accompaniment of aging. We should strive hard to give our aging population a good quality of life. And this can happen when we address their pain in a holistic manner. I think we should do that.